Total hip arthroplasty, or THA, is used increasingly often and on ever younger patients. Many of these patients wonder about the risks related to sexual activity after the procedure. Unfortunately, this issue is rarely discussed between patients and surgeons. To date, the relative risk of impingement and joint instability during sexual activities after THA is unknown. The hip range of motion necessary to perform sexual positions has also never been quantified. The goal of this study was to obtain realistic motion data for 12 common sexual positions and to evaluate the relative risk of impingement and joint instability during their practice. An in vivo study using optical motion capture and magnetic resonance imaging, or MRI, was carried out on 2 healthy volunteers. First, 3-dimensional patient-specific hip joint models were reconstructed from their MRI data. Then, the 2 volunteers were asked to participate in a motion capture session. The recorded 3D trajectories of the markers were used to compute accurate hip joint kinematics based on a validated optimized fitting algorithm. The hip range of motion was quantified for each volunteer's hip during all 12 positions and was expressed in clinical terms. Sexual positions for women required intensive flexion, abduction, and mostly external rotation. For men, flexion and abduction remained within the normal range, but external rotation was dominant for all motions. The motion capture data was then used for computer simulations of 3-dimensional prosthetic hip joint models. 9 different implant configurations were developed based on variations of the acetabular cup's inclination and anteversion parameters. While visualizing the prosthetic models in motion, a collision detection algorithm was used to locate abnormal contacts between both bony and prosthetic components. Moreover, femoral head translations were computed to evaluate the joint congruence. For women, most impingements were observed in 4 positions requiring high hip flexion and abduction. For men, impingement remained scarce except for 1 position where bony impingements were observed at all cup positions. This study shows that sexual positions for women require an intensive range of hip motion, whereas sexual positions for men require less mobility. As illustrated here, some sexual positions could expose patients to impingement associated with joint instability and could thus be a potential risk, particularly for women. Full methods and results can be found in a paper published in the Journal of Arthroplasty. To learn more about ArtAnim and the work we do, visit our website or watch the videos below.